And with the rapid surge in COVID cases over the past weeks here in Northeast Ohio, our hospitals have been under pressure. I got a look inside the ICU at Cleveland Clinic Marymount Hospital in Garfield Heights and heard for myself the strain our healthcare system is under and the call for help from healthcare workers.
They're very sick. They're very sick.
In Cleveland Clinic Marymount Hospital's ICU, a team cares for those who are critically ill. At the time 3 News was in the ICU on Wednesday, 13 of the 23 patients there were COVID positive.
So that's definitely a source of frustration, and we're kind of tired of seeing it.
Dr. Jonathan Castro, director of the medical ICU, has been treating these patients since the start, when Marymount was designated as the original COVID-19 hospital for the Cleveland Clinic enterprise, learning and changing just as quickly as the virus.
Our most precious resource is our people, the caregivers. Without them, none of this will work out.
Caregivers like critical care nurse Kenneth Kunzelman, who just started at Marymount 6 months ago.
That's pretty much what I've dealt with since entering Marymount. Lots of COVID cases.
Most of those COVID patients are unvaccinated.
It is exhausting. It's frustrating because I believe, if people did get the vaccine, help make a better outcome for them.
It would also help alleviate pressure on an already stretched hospital system. Lauren Rogers, director of critical care and emergency services, says there are patients waiting in emergency rooms to come up to the ICU.
We have an amount of patients who need our help and who are in our emergency rooms waiting to come up. And so we are asking our teams to do more with less.
With staff shortages and even more patients, they've had to bring in support from other departments and specialties. Critical care nurse Patricia Sturm has been picking up extra shifts and extra patients, up from her usual 1 or 2.
And I'm not going to say it's not difficult, because for an intensive care, having 4 very sick patients is very difficult.
The staff at Marymount has leaned on one another to get through with teamwork, but now they need to lean on the community.
Hospitals are jam-packed with patients. The ICUs are full. The one thing that the public can help us out with is by getting the vaccine. It truly makes a difference. It prevents serious illness.
And everyone I spoke to, they just couldn't emphasize enough the teamwork that has happened to make sure that they are providing quality care to as many patients as possible. And still, though, I mentioned that 23 beds in the ICU were occupied when I was there. They actually have 28 beds in total in that unit. But the issue here is staff. They don't have enough staff to man all those rooms. But again, they do see the demand there. So a tricky situation these hospitals are dealing with.
Yeah, it really is. And you had a line in your piece there that I thought was very prophetic, because it really does feel like the race here is between the changing virus, which we know has emerged in different forms, and the scientific community and the medical community to try to keep one step ahead of it. And right now, we're seeing the Omicron is obviously surging. The expectation is we're going to peak very soon with those number of cases, and they're expected to come down dramatically. But then it's almost as if the medical community and all of us really hold our breath with what's next. Because after Delta came Omicron. Is there another one down the road that we'll have to worry about? The odds are it wouldn't surprise most if another variant comes to be.
Yeah, I think that's the big question. And you could tell, I'm sure, too, just from the tone of so many of those healthcare workers, they are dedicated, they are here and ready to work and care for people, but they're exhausted, they're tired.
You can see it, yeah.
Yeah, and so anything that the public can do to help get those vaccines, take the precautions, wear the mask, social distance, will lighten the burden on these really hard-working and hard-worked healthcare workers.
Yeah, and every little bit helps. Terrific report. It's interesting to pull the curtain back and see exactly what goes on in these hospitals and ICUs.